that heard there South Africa's. In fact, we continue with this conversation. Let me put my glasses on for a start. That should assist us there. We continue now with this conversation. We've just heard the South Africa Uganda Disability Inclusion Study Tour, which brings together government officials and disability advocates from both countries to share experiences and strengthen cooperation on disability inclusive social protection, which is currently underway. And to take this conversation a little further and to better understand South Africa's priorities in advancing disability inclusion, we're now joined by the Minister for Women, Youth and Persons with Disabilities in South Africa, Honourable Sindisiwe Chikunga. Minister, thank you very much indeed for joining us, and welcome to the programme.
Thank you very much, Peter, for having us, and good morning to your viewers.
So, Minister, we were just listening there to Uganda's minister praising South Africa's various programs, its model of social protection, especially the disability and care dependency grants. How significant is this collaboration between South Africa and Uganda, particularly when it comes to strengthening disability and inclusive development?
We have the relationship, long-standing relationship with Uganda. It started in 1994, but of course even before 1994. And of course, like the DG indicated, in 2023, the president of Uganda came to South Africa at the invitation by our President Cyril Ramaphosa. And there was this MOU that was signed. Sometimes when you look at MOUs that get signed, they will not talk to issues that are social in nature. But this one was signed on the field of women, youth, and persons with disabilities. And it covered quite a number of areas, including the area of disability inclusion. And in South Africa, that first is in the Constitution, the issue of equality, irrespective of ability or disability, sexual orientation as such, it is in the Constitution. But indeed, we also signed the United Nations Convention on the Rights of Persons with Disabilities. It therefore made us as South Africa to then draft our own policy on the rights of persons with disabilities, localizing the UN one in South Africa. And if you look at it, as the minister was saying, the IMC, that is Interministerial Committee, was also established, and it is chaired not by the minister but by the president himself, which elevate the matter of disability to the level of the president. And that is why we are able to look at the pillars of our policy and say which one are we implementing, which one are we lagging behind, and why. And if you look at other important things that have happened is the establishment of the department itself, that ensures that it advocates, it mainstreams, it monitors, it evaluates issues, including issues of disability inclusion. So this visit, benchmarking visit by Uganda, one enables us to look at ourselves, because we've got to share information with them. But of course, to say how far are we as South Africa, but how far are we in the implementation of some of the issues that are in that MOU that we signed, but also to learn from them, because definitely there are things that we are going to learn as we share experiences with them. Yesterday, when we were addressing them and looking at our 8 pillars of our white paper or policy, they actually were writing and looking at the pillars, what they cover. And if you look at them, for instance, the pillar 1 is on protection and promotion of the rights of persons with disabilities. And this is an important one, because we have got to look and say, how far are we in that regard? And we said, we have a department that ensures that these rights are protected, and we insist on that by other departments. If you look at pillar number 3, for instance, because there are quite a number of them, it talks to promotion and promoting access to services. And these services, they talk to education, they talk to health, they talk to transport, universal access, etc., etc. And we can sit down and say, when it comes to health, for instance, are persons with disabilities in South Africa accessing it? And we can say yes, we can say, but there's room for improvement. If we look at education, for instance, we say are persons with disabilities in South Africa accessing that, and we can therefore share experiences to say, for instance, we introduced the universal access to education, but the challenges were that teachers were not trained to deal with persons with disabilities. For instance, with people who might have problems of sight, you'd find that in a school there's no one who can actually look at that and be able to teach them. So these were the challenges, and therefore we still continue with the special schools, which sometimes exclude persons with disabilities and isolate them. And we therefore can share experiences as to what it is that they are doing in Uganda and what it is that we are doing in South Africa in trying to deal with that challenge. You look at the issues, for instance, of transport access, for instance. You think about people on wheelchairs that will complain sometimes to say we pay for wheelchairs and ourselves, and how best do we address that? We can learn from each other to say what is it that they are doing, how do they involve the operators, for instance, transport operators, so that even persons with disabilities can have access. You look at the aviation, you look at maritime, you look at rail, etc., etc. So these are the things that we are sharing with, but also giving us time as South Africa to look at ourselves, to do introspection as we share with them our experiences.
You talked about learning there, and I just wonder, I mean, South Africa's social protection system for persons with disabilities is often regarded as quite a model for the continent. What would you say are some of the strongest features that other countries perhaps can learn from South Africa that we seem to be doing well?
We are doing well when it comes to social protection, even of persons with disabilities. We, as a department, we say disability is not equivalent to a grant. There are persons with disabilities that do not need any grant because they too can participate actively in the economy of the country. They can work, they can be employed, and that is why we've got Employment Equity Act in South Africa that demands government and private sector to employ persons with disabilities so that they don't have to qualify for just to get grants. However, there are persons with disabilities that definitely require grants, and these are actually protected and are covered in that form of social protection. And if you check, even the minister was sharing something that says for them it's like you have got to reach a particular age in order, even if you have a disability, in order for you to qualify for a grant. And it was also like, if you look at their social protection age, if I'm correct, she was talking about 8 years and so forth. In South Africa, at 60 years you qualify for a grant because there is an element of some disability that can creep in there, but of course you are a retired person or a pensioner at that stage. But persons with disabilities, irrespective of age in South Africa, if the disability makes a person, renders a person not able to participate actively in the economy, then of course they qualify for grants. And this is a model that you're not going to get in the continent, but it's a model that you're not even going to get in other developed parts of the world. And therefore it is the best because it takes care of its persons with disabilities. But we do not sometimes talk about those that become disabled because of road accidents, that also get protection and compensation from road accident fund. If you look at it, it is still part of social protection, in that the road accident fund will also compensate them, but also provide them with assistive devices, with, for instance, care, provide them with people that can take care of them, which also is the case with the social protection that is being rendered by the Department of Social Development. So yes, we're sharing that. In fact, they were surprised. They looked at the amount that is being spent by South Africa, and I think that will also be the focus today by South Africa on social protection. And it is something that we are celebrating for our persons with disabilities, because it gives them that ability and that right to live like any other person. Whilst we say any disability should be evaluated and assessed, so that we say on the basis of this disability, this person does require a grant. But it should not be like once a person has a disability, then we say we equate any disability to grant. Persons who can see, persons who cannot hear, persons who cannot walk, but they are able to do the work and they are able to achieve in education. And in the department here, we have a doctor who can't see. She's PhD and she's doing exceptionally good. So it's possible for persons with disabilities to go to school, to participate actively in the economy, and to earn a living. Young persons with disabilities, they want to participate in the growing of the economy of South Africa, then to just equate them to a grant. But however, there will be those that will qualify to get a grant, and of course the system in South Africa allows them to do that.
Minister, the Uganda delegation also spoke about the importance of integrating disability across all national development programs. And I'm wondering how South Africa is ensuring that disability inclusion is mainstreamed across all sectors like education, health, and employment. You may have partly answered this question, though.
In fact, that is the mandate of the department, and that is why the Department of Women, Youth and Persons with Disabilities exists. Its core mandate is to ensure coordination of work of all departments, of all sectors, of all civil society, private sector per se. Looking at persons with disabilities, we have a responsibility to advocate. We have a responsibility to mainstream. So when the government or cabinet is sitting, for instance, to adopt its medium-term development policy, we look at whether that features in all sectors, in all departments, the inclusion of persons with disabilities. When policies are presented, we are there to say where are the persons with disabilities. When ministers, for instance, present boards that they are appointing, our presence there is to say, do we have a person with disabilities in your board, minister? And it is now a convention that any minister that brings a board to cabinet for approval, that board must have a person with disabilities. That is our core mandate. If it doesn't happen, it might actually mean that as a department we are failing. And we do that not only within the public service, but even in the private sector, in the civil society, etc., etc. We are there to ensure that persons with disabilities, and that is why looking at our G20 legacy projects, one of them is the NEF Center that we would wish to establish for persons with disabilities, to ensure that we have a proper database for persons with disabilities. We know where they are, we know what they are doing, and also maybe to look at, to include other departments. We've been raising and talking, interacting with the Department of Health to say would want to see persons with disabilities being identified at birth, so that we are able to plan better for a person from birth until death, so that it doesn't have to happen that they get identified when they go to a crèche or ECD, etc., etc., because it means there's time where we are not able to plan for that with disability like any other child who is born without disability. But we know that this child will go to a crèche, and therefore there must be crèches, they will go to ECD, there must be ECDs, they will go to school. We must be able also to say from birth, this child will require a special school or a normal, a universal school, and plan for that child, and look at the number of special schools that we have, so that we're able to increase and attend to the infrastructure and the resources that are required on the basis of the child that we'll have known about from birth until death. And these are the issues that we are discussing. And we think that if we're to have that nerve center, and there are people that are to establish it, we believe that we'll therefore be able to have and to capture this information as a department. So yes, indeed, the issue of streamlining, the issue of coordinating, the issue of advocating, the issue of monitoring, the issue of evaluating, it is our mandate as a department.
This study tour is about learning and sharing. What has struck you the most about Uganda and what they're doing well that perhaps South Africa can think about adopting?
For the very fact that the minister is with a disability, it is encouraging. In our meeting yesterday, they did not cover a lot, but of course we also had to leave because we had other commitments. But I believe that they have a budget. That's what the minister indicated to us, that they get a budget like other departments, and therefore from their side as a department, they are able to intervene. And I think that is what is missing in South Africa, that we are only intervening, we're only dependent on everybody else. Even where we believe we could intervene as a department, we cannot, because our resources are such that we can't intervene. I'm just going to make an example. We have quite a number of institutions of persons with disabilities or organizations. They will say, Minister, we need wheelchairs. And for wheelchairs, we are dependent wholly on the Department of Health. But we believe, or if it is, of course, a person who became disabled because of accidents, motor vehicle accidents, then of course it will be road accident fund. But otherwise, you think that if we had a budget for intervening like other governments do, if you go to Italy, for instance, the minister has a budget and she's responsible for disability and disability only, and she's running projects herself, we would have moved much faster on things. And I think that is where we can learn from Uganda. You are able to come with projects, for instance, that is looking at technology to say, how best can we use technology for persons with disabilities? If you look in South Africa, you cannot think of any department that will provide technology and look at technology for persons with disabilities, making it possible for them to participate better than if they don't have those. So these are the things that I think we're learning from them, but from other countries as well. From Brazil, for instance, if I were to quote, they do have budget for the minister in the responsible for persons with disabilities or disability inclusion to intervene and to have projects that herself is implementing and running with. In South Africa, there are things that you cannot locate, even if you want to mainstream or to advocate, but you don't know where to go, because where do you go, for instance, for technology that can assist persons who are deaf, for them to be able to see from their cell phones, and out of that actually be able to understand what is being spoken in the room, who can intervene in that. And therefore those are the things that we think we're learning from Uganda.
Minister, we wish you the best in terms of the rest of this tour and the deliberations between you and Uganda. And we thank you so much indeed for joining us on Channel Africa this morning.
Thank you very much, Peter, for having us.
Thank you very much. That's South Africa's Minister of Women, Youth and Persons with Disabilities, Honourable Sindisiwe Chikunga, talking to us about this collaboration between Uganda and South Africa in this sector. It's time for your news headlines. Here's Onele Nsinzi.